Good morning and welcome to Waking Up with Don. Today we're waking up with Dr. Vincent Ivers here at the Medical Cosmetic Center. Vincent Ivers, you're an old friend. I mean, we've known each other for quite a few years now. Our kids went to the same school and all that stuff.
That's right. Seems like I'm glad to see you again. Looks like you're doing very well.
And you too, actually.
Life is good.
You know, after all these years that we've known each other, you've never given me a free procedure.
We'll invite you anytime. We've got the machine here for you.
No, you're gonna need all the machines for this face. But seriously, you know, cosmetic surgery has come a long way, or just cosmetic treatments. You don't necessarily have to have surgery to look better, do you?
Oh, sure. Nowadays, with the advent of Botox, since then, the whole realm of cosmetic medicine, cosmetic surgery has changed completely. We have multiple lasers, multiple fillers, fillers from just that stay on board for a few months to several years. So it just depends how much you want. We have skin tightening lasers, minimally invasive to a little more invasive. And that all came about within the last 12, 13 years. Before that, there was really not much out there.
Yeah, so you don't have to go in and get a full facelift. I mean, you can come in and just get a little tune-up or a little, you know, tune-up around the edges, so to speak.
Yeah, most of our patients are, you know, loyal patients that come in, you know, get a little tune-up of Botox, do a little laser, a little skin tightening, and come back next time, a little vampire lift or a little PRP. It just, there's things that come.
Okay, now you got to tell me, what's a vampire lift?
Well, that's when we inject deep down, like one of the fillers. We usually use Artefill these days, just it's a more permanent filler. And above that, just to give the skin a better glow, we actually remove your plasma, inject on top of the filler, so it kind of gives you a nice bright glow, really refreshes your skin. And that actually keeps on working for many months on, and it helps you really give you a nice glow to your skin. So it's a kind of a neat new procedure, and we use a lot of that with some of the fillers that we use.
What is your most popular procedure that you do here? Do people come in, is Botox the big thing, or what do people come here for?
Botox was what everybody started out with, and we still use that in combination with a lot of the different procedures. But now it seems like this has kind of gone from just filling up the little lines to doing a whole body makeover, from giving volume to people have lost volume. The Botox helps where you lose a little fine lines around the eyes, fine lines above the forehead. But in addition to that, we try to volumize the skin and also do a skin tightening or a laser tightening to the face. And it's kind of a combination treatment where patients usually get the best results.
When somebody walks through the door of the Medical Cosmetic Center, what can they expect? Because I know I look around your practice here, and it's very homey. It's like it's almost like a spa.
Well, that's the whole idea of this, the cosmetic center. We try to make patients feel welcome, very comfortable, and we don't try, this is not like a regular, you know, medical practice, dermatology practice where we bring them in, bring them out. We first just sit down. We have a vision where we do a skin analysis, and then I'll sit down and review with them, see what their expectations are, what they want to get done, and what they really want to get out of all this. And I usually will sit down and give them a specific guideline and just mark down things that we can do and make sure they have real expectations. If you have completely unreal expectations, you're 80 years old.
So part of your job is really managing expectations.
Sure.
Like I come in and I say, hey, make me look like Ricky Martin. I mean, yeah, it's asking a little too much, right?
Yeah, well, we want to look our best, especially, you know, you're in the television every day, you want to look your best, and you know, there's a lot of things that you can do to just give your fine tuning. So that's one of the things that.
But you want it to look natural too, don't you? I mean, you don't want to go into work one day and look totally different. I mean, you want to go in and just maybe look a little more healthy, a little more refreshed.
Well, we try to manage with the anti-aging hormones plus the outside. So it's a combination of everything. It's not a one-stop shop. We do a lot of different treatments, including we check your hormones, make sure that looks okay, especially if you're getting more fatigue.
So as a doctor, you do a medical analysis first before you start treating them and make sure they're a good candidate. Now, I notice you have a lot of machines here and, and a lot of different and kind of exotic equipment. We've got to go to a break right now. Okay. But on the other side of these messages, maybe you can show me some of the things that you use to make us look better.
Sounds good.
You're watching Waking Up with Don. I'm with Dr. Vincent Ivers. Welcome back. I'm here in the chair with Dr. Vincent Ivers. I've put myself in his capable hands because he's going to take me through what you would go through if you came in here for Botox, which is a pretty popular procedure nowadays, isn't it,
Doc? Very popular. And since this is your first time, we're putting a little numbing medicine and just going to take it easy on you. Remember, this takes about 3 or 4 days to kind of actually kick in.
Take it easy on me because I am a coward. I have to.
Well, men, we're the weaker sex. It does. We usually take it easier on guys because we definitely don't take pain quite as well.
No.
For some reason.
Oh, women have that whole childbirth thing, so that's
something.
They know what pain's about, I suppose.
But we usually let the numbing medicine in for about 10-15 minutes, and then this is the area that most guys especially want to have done. And then we put a little bit around the sides, and then we usually bring you back in about a week just to take a look, make sure there's enough. If we need to add a little bit more. Men usually require a little bit more Botox than women.
Really?
That's the only thing. You got stronger muscles up there, so we usually put a little bit more. If we're going to put like 30 units in a women, we usually put at least 50 units in a man.
Okay.
So there's a lot more. And we usually have my capable assistant to remove the numbing stuff. And
I have no idea what I look like right now. So
you got just some white stuff
very nice
smeared on your forehead there.
This is a first for the show.
And usually the worst we've seen with this is you get a little bruising, but that's usually if we do a lot around the eyes. Usually not a big deal around the forehead.
All right, so now the numbing stuff, and I'm feeling comfortably numb.
Yeah, that should help.
There's a song called Comfortably Numb, I think, Pink Floyd.
Should have that playing right now.
I know we should.
All right, go ahead and put a little numbing medicine, the ice on his forehead there for me.
You know, last week it was snakes in the studio from Zoo World, and now I'm getting needles in the face. It's
well, this is better than snakes, I think.
Yeah, I think so too. I hate snakes. Yeah, we had the people from Zoo World out. It was pretty scary stuff.
That's one of the few animals that just
I don't
cringe.
Now, people are afraid of needles too. Do you have people that come in here that are just afraid to get a needle?
Usually just the first time. After that, they're pretty good to go.
Okay, so what are we doing now?
I did your first shot. This is a strong muscle there. Second shot.
Oh, wow. Okay.
And I'm going to put a little bit right, since you got some strong muscles there, put a little bit there. Now. Good deal. Now I'll leave the ice on there. I can just put a little dab just on each side. That just helps your wrinkles there. Yeah, just leave a little ice on there for a few minutes.
Wow.
So you don't get any bruise. Let me just add a little more to that right side.
This actually is relatively painless.
Yeah.
I mean, you feel a little pinprick, but it's not what I would expect it to be.
Yeah, the needles are very tiny. They're almost like the acupuncture needles, basically. So it's not like.
Because I really am a coward. I think we established that early in the shoot. And what does the ice do?
It just prevents you from getting any bruising and any swelling. So you should just, and if you notice there's any type of bruising at all when you get home, just add a little bit more ice just so you don't bruise up. I just want to put a little bit more just to this side here. Good deal.
Is that where most people get it in their around the eyes and the head? Is that a trouble spot?
Well, I'll do the first one, and then usually patients like the results. They'll come back in a few weeks and they want everything done. And patients that we've done for many years, they know where they want it and they have it done. Now the swelling will go down in about an hour. Okay.
Yeah, those little bumps, they're not going to stay, are they?
That's why we put the ice.
Yeah, the swelling will go down in about an hour. They won't stay there for the whole day. You can say, Dr. Ivers did that.
Dr. Arias gave me bumps on my head, you know. No.
Yes. He can blame me for that.
Not many guys can pull that look off. I'm hoping I can. So this will go away. Those little bumps will go away.
Bumps will go away. If you have any bruising, just make sure you go, when you get home, just put a little ice on. That usually won't last more than a day or two. Okay, but the little bumps will go away by the time you probably get out of here.
Well, Dr. Ivers, thanks so much for showing us how this procedure goes. I've always been kind of curious about it, and it's actually painless, and it's almost kind of a little fun being here because it's such a spa-like atmosphere. I'm quite relaxed. Yeah, I'm getting a good vibe from this place. So anyhow, we've got to run off to a commercial break, but on the other side of that, we'll have more fun stuff. Waking Up with Don. We'll see you on the other side.
Hi, good morning. Welcome back to Waking Up with Don. I'm Zenobia Andrews, your business system strategist, and I'm excited to bring you your max out moment, your max out tip for today. And today's tip is low cost options to start your business. Isn't that amazing? Low cost options to start your business. And one tip for that is I use a resource. It's a website. It's called Fiverr, F-I-V-V-E-R, and what they do is they help you with the marketing, they help you with the management of your business. If you need a flyer, if you need a brochure, anything like that, they can do it for a cost of only $5. Can you believe it? $5. Make sure you check them out. It's called Fiverr. Another website that I use, it's called Hootsuite. Hootsuite, yes, get in the game of using Hootsuite. Hootsuite is amazing. If you have a Facebook page, a Twitter, Instagram, LinkedIn, Google Plus pages, all of those marketing social sites, you want to have one domain, one place where you can go to manage all those sites. Hootsuite, it's absolutely free, right? We love free. We love low-cost options. Tap into Hootsuite. In addition to that, my last point is Elance. Elance is another social media managing site as well. It also helps you with your marketing, your advertising as well, and you bid contractors for the work that you need done. Listen, this is your max out moment for today. I am your girl Zenobia, your business system strategist. I would love for you to connect with me. I would love to serve you if you need help in your business. You can reach me at my website, www.zenoviaandrews.com. You can find me on Twitter. You can find me on Instagram. You follow me, I follow you back. Have a great day.
Welcome back. I'm going to get a little face scan and an analysis of what needs to be done to make me pretty. It's a lot of work on your hands here, Doc.
Well, Don, this is our visual skin analysis. Essentially, we're going to do one good picture of the whole face, and this will determine how much sun damage you have, skin wrinkling, deep sun damage, possibly even some skin cancers, and the rhytids, the little wrinkles around your eyes and stuff, and see what we can do to fix it. Okay. And then we have the options to treat those. So go ahead and place your chin right in that little area there, and Trish is going to go ahead and take a picture of you.
Okay.
Just don't get scared.
Close your eyes.
Eyes are closed.
Okay, ready to take a picture. Cursor's not going to work. Here we go. Relax.
All right.
Okay.
And then I'll print out a little leaflet just showing you what we've done.
I need to dye my eyebrows. I can tell you that right now, and I actually do that. But all right. Yikes.
So you can see how it's going really deep inside, just looking at any irregularities there.
Can you get that? Am I heading away? All right. Ew. Yuck. Am I that ugly? That's pretty amazing stuff. Now, what are we doing here with that?
Well, we're kind of looking at the major parts of your face to see where the sun damage is. Try to leave the actual eyes and the mouth out, because especially guys with the beards, this give you a good analysis, just the the simple skin, see where you're at with that. We can always go back and do a overall, but this will give us a good idea where your skin, your balance is, and what we need to do about it. And then after that, it'll get ratings of everything, percentages on what are good as far as, and this is age specific. So compared to your age with your similar skin, how much sun damage you have, how much like actinic keratosis or different type of irregular skin cells you have, and
which would be substantial, I think, in my case, because I spend a lot of time outside.
yeah. Well,
yeah.
In your case, you have more of a Mediterranean skin, so it shouldn't be as bad as somebody with a Scandinavian skin, where you have a lot more, you know, the redness and the rosacea type.
And the higher the numbers, the better your scores.
Okay.
This is the visible spots that you can kind of basically see with the naked eye.
So the higher the number,
The better.
the better. Okay, so spots 82% means.
So that's pretty good.
Yeah. Okay.
Wrinkles.
Wrinkles 56%.
And this is where in this you need to use a lot of moisturizer. Be sure you're using your sunscreen.
Okay, sunscreen and moisturizer.
And these should help with the Botox you just done.
Okay.
And also we have a procedure that is a radio frequency that will help smooth these areas out, and also these areas too.
Wow.
And the ladies really like that because it only takes about 5 to 10 minutes.
Do you
to do
have
that
many male
procedure.
patients, or is it mostly females for the most part?
We have probably, I don't know, 5 to 1 female to male. There's a lot. We have a lot more female, but we do have male patients also. And
Well, good. I feel better about myself now.
And this is the texture of your skin. There's a lot of things that you can do for that. The microdermabrasions is the least invasive. And
Does that mean it's
also-
rough? The
Yes.
skin?
The texture of your skin, and the CO2 is perfect for that, the CO2 fractional laser. And that's one of our most popular procedures because it resurfaces the skin, stimulates that collagen, gets rid of all of these fine lines, and gives the skin a more youthful appearance. So that is one of our most popular ones. And this is your pores. Bad. These purple areas, those are your enlarged pores. The
Yeah, that's not too bad.
fractional laser would help tighten up those pores. And like I said, the microdermabrasions would help clean those out and tighten them up too.
I do nothing but soap and water on my face.
that's typical, yeah.
Yeah.
But yeah,
Yeah.
Now this is what you don't want. You said you didn't wear sunscreen.
Uh-huh.
That's precursors to skin cancer.
It's all skin damage. That's all sun damage.
That's all sun damage.
Ugh.
And these are the brown spots underneath the skin. These are basically your age spots. As you age, you'll start getting those darkened areas that you don't want.
Yeah, those are the ones you can't see yet. They're coming deep. But there are lasers, like intense pulse light lasers, that will kind of help pull them up to the surface and gradually move them also. So every one of them had, at least there's treatments for it. And the same treatment we use the brown spots, also the porphyrins, they're like the same laser. And unfortunately, each are different lasers that we use. But you know, you don't have too much of the rosacea, the red areas there compared to some patients.
This is just your broken capillaries, and a lot of that is due to aging. So,
Oh, I thought it was from laughing really hard. Yeah. Broken capillaries. I don't know.
all right, this is what you don't want. This, you said you use just soap and water. You need to use an antibacterial. So
Ooh.
we have a good skin line.
Are those germs on my face? Is that what I'm looking at? Okay, now you freaked me out. Now I'm officially freaked out.
Remember a lot of those large pores that you saw earlier? Well, that's the bacteria down into them.
Okay.
And so you need to get on a good skincare line. Okay.
But this is a nice, because we can, you know, treat you and do this again in about a year, and you can see the actual improvement, which is kind of nice, you know, especially after several lasers and the reduction of some of the fine lines and the texture improvement. So at least we can kind of document.
So this gives you a little baseline of what to do. Oh, wait a second. You get a shot of that? I mean, that guy looks a lot like that guy. I don't know what's going on here, but...
Okay. So that's basically it. Since we didn't go through the whole series, it's not going to give you a lot of
Well,
comparative
this has
shots.
really been very illuminating and educating and a little bit scary. But Dr. Ivers, thank you so much for showing us your place and for the for the shots. And,
And just remember, it'll take about 3 or 4 days to kick in there. And actually, usually, if you need a little more, we'll actually do a little on the forehead up above there, because you won't be able to frown as much now. At least your wife will say, "You can't have frowning." Just good.
Give her a few shots too. Well, thanks again, Dr. Ivers.
Thank you for
and
inviting me.
yeah, and we hope to come back again soon.
Good deal.
You're watching Waking Up with Don. We'll see you next time.